Welcome to the Recovery Trial background training. Thank you for your interest in the trial. As you know, a novel coronavirus-induced disease was identified in China at the end of 2019, and the causal agent was identified as a new beta coronavirus called SARS coronavirus 2, or SARS-CoV-2 for short. Symptoms of this disease vary from none to a mild viral illness in the majority, through to severe pneumonia in a minority of cases. Unfortunately, to date, nearly 100,000 people have died from COVID-19 in the United Kingdom. The progression from prodrome through to severe disease takes 1 to 2 weeks, which offers a therapeutic window. The recovery trial has already demonstrated that neither hydroxychloroquine, lopinavir-ritonavir, azithromycin, nor convalescent plasma reduce the risk of death. However, the recovery trial has also shown that dexamethasone significantly reduces the risk of death among patients receiving oxygen or ventilation at baseline. The trial continues to investigate other treatments in adults, and please watch the relevant separate training videos about those which are relevant for your site. If you're involved in the treatment of children or pregnant women, please watch the separate videos for those groups as well. Patients are eligible to enter the recovery trial if they have been hospitalised and they have proven or suspected COVID-19. They should have no medical history that might, in the opinion of their attending doctor, put the patient at significant risk if they were to participate in the trial. The primary outcome of the trial is all-cause mortality by 28 days after randomisation. Secondary outcomes include the duration of hospitalisation and, among people not on ventilation at baseline, the need for mechanical ventilation or death. Subsidiary outcomes include the need and duration of ventilation, use of renal replacement therapy, and other outcomes. This is the current design of the trial. So eligible patients, as I have just described, can enter the trial, and they can enter 1, 2, 3, or all 4 of these randomisations, depending on which treatments they are suitable for and which treatments are available at your hospital. Part A of this randomisation compares colchicine with usual care alone. Part B compares the Regeneron monoclonal antibody cocktail, REGEN-COV2, with usual care alone. Part C compares aspirin with usual care alone. And Part D compares baricitinib with usual care alone. Outcomes are then collected at the earliest of death, discharge, or 28 days after randomisation. If a study treatment is contraindicated for a given patient, they can still be randomised into the trial between other treatments which are both available and suitable for that patient. The randomisation process is simple, meaning there is no stratification or minimisation. So while COVID-19 is a mild disease in the majority of patients, a significant minority require hospitalisation and face significant risks of morbidity and mortality. The recovery trial is testing immunomodulatory, antibody-based, antithrombotic therapies and others to assess their effects on major morbidity and mortality. As an adaptive platform trial, other arms may be added to or removed from the platform in the future. Thank you for your attention.